Hi, Kevin Sartin with Non-Monastic Physical Therapy with an educational video on hip dysplasia. So what is hip dysplasia? It's the underdevelopment of the hip joint or the acetabulum. So our hip joint is what our femur sits in right here. And typically it is a nice, deep, stable joint. In hip dysplasia, it's shallower and therefore there's not as much stability in that joint. What makes you more likely to have hip dysplasia are one, genetics. So typically, if your parent had hip dysplasia, that would make you more likely to have hip dysplasia, and then your kids, and so on and so forth. Also, women are more likely to have hip dysplasia than men, 6 times as likely to have it, actually. And then firstborn females are even at a greater risk for hip dysplasia. If you had a breech birth, if you're tightly swaddled as an infant, and then also if you have connective disorders, connective tissue disorders like Ehlers-Danlos syndrome. So all those things will make you more likely to have hip dysplasia. So what does it present as? Well, there's 2 different populations, so I'll kind of break that up a little bit. So infants are one segment of that, and about 1 to 3% of babies will have hip dysplasia. And how this is caught generally is, one, they might not walk as quickly as their peers would. And then, in your infant checkups, they're going to look at a couple things. One is going to be their gluteal folds. So they'll kind of look and see if their gluteal folds are in line, if their leg lengths are similar, and if they're not, that would make them suspect that hip dysplasia is a possibility. They can also do some imaging with ultrasound to determine if this is the case. And treatment options for the younger population here, if they catch it whenever they're really young, 0 to 6 months old, they can do harnesses or casting to put them in a position where they're flexed and externally rotated, which should help that joint to develop more normal shape so that they have better stability later on. If this does not fix it, there are other options. So if they're about the age of 2, they'll try physical therapy, and there's also surgical options that can be performed as well. So they can do what's called a pelvic osteotomy, which doesn't sound real fun, but they'll cut the pelvis and change the angle of the hip joint here to make it better sit on the femur so that they have more stability. And then they might also try to reshape the acetabulum itself through a surgical intervention. And anyways, so that's kind of the infant side of things, and those are the options to improve that. And then on the adult side of things, typically, if this wasn't caught whenever they were younger, maybe it was more mild, but they start to develop symptoms of pain and instability later on in life. This typically will happen between the ages of 20 and 40, again, more common in women. And the prevalence of this in individuals is about 2 to 5%. The things that would make you think that you would have this, you're going to have pain, you might have instability, popping in the hip, which is pretty common in other conditions too. So don't jump to this conclusion. And you might have reduced range of motion, not because you might be very mobile. You might have a lot of mobility, but you're not comfortable going through certain motions because of that instability that your joint has. And the treatment options for the adults, if they find hip dysplasia later in their life, are physical therapy. So going to work on increasing your strength of the muscles surrounding that joint to help with that stability and hopefully delay or even prevent any surgical interventions. If pain is one of the symptoms that you're experiencing, they can do pain medications like Tylenol and NSAIDs. This is going to just allow for short-term relief, and they also can do injections like corticosteroid injections or hyaluronic acid injections. But again, these are not going to change the actual structure of the hip itself, but just help short-term with pain relief. And then if the conservative approaches are not beneficial or not helpful at solving the solution, hip replacements are the other options that people might eventually turn towards, which are pretty successful at relieving pain, 80 to 90% effectiveness. So, and then after that was done, then they'll have about 6 to 12 weeks of physical therapy at that point in time. So anyways, there's hip dysplasia. There's a lot there, but there's those common risk factors that might make you think that you would be more susceptible to this. And it's something that can get better conservatively, and then there is that option for surgical intervention if it does not. So hopefully you found this video helpful, not too long and not too boring. I'm sorry. But give us a call or visit us at our website at nodpt.com if you have any questions or need further help. Thanks.